You have joined the Treatment and Recovery Resource Meeting. This meeting is a product of the Treatment and Recovery Committee for the Governor's Alabama Opioid Overdose and Addiction Council. These virtual calls are designed to provide valuable insights, resources, and support for professionals involved in helping someone gain access to treatment and recovery resources. Each meeting will feature 3 dynamic speakers representing different organizations who will share the resources they have available to support our important work in the field of treatment and recovery. These meetings will occur on the first and third Wednesday of every month at 12 p.m. So please continue to join us as they occur throughout the year and feature new agencies with each meeting. The Zoom link will remain the same for every meeting this calendar year. Each agency will have 15 minutes to share about services and referrals, followed by 5 minutes for any questions our attendees may have. We ask all participants to remain muted during the presentations. When we open for questions and answers, you can unmute to ask your question, or you may type it in the chat and we will ask it for you. Without further delay, I'm excited to introduce the 3 agencies for today, our Alabama Alliance for Recovery Residences, SpectraCare, and Ross. So we will go ahead and begin with Alabama Alliance for Recovery Residences.
Okay, thank you, Audra. And hey, everyone, I'm so glad you're all here. And thanks for the opportunity to talk a little bit about AARR. My name's John Bayles. I am the president of the board of directors for the Alabama Alliance of Recovery Residences. We can go ahead and get the pirate joke out of the way. There was no way to get around it. We are AARR. So we tried really hard to come up with a different acronym, but you'll see why that was a little difficult. So I'm going to share my screen. Okay, can everyone see that?
We can.
Okay, very good. Okay, so who we are the accredited NAR affiliate for the state of Alabama. So NAR is the National Alliance of Recovery Residences. It's a 501c3 nonprofit that's dedicated to expanding the availability of well-operated, ethical, and supportive recovery housing. So NAR is, they are the most widely referenced standard when it comes to recovery residences. They're recognized by SAMHSA. I'm sure we all know what SAMHSA is, along with the Oxford House, which is another very well-regarded model. They are the only 2 models that are recognized by the federal government as evidence-based best practices when it comes to recovery residences. NAR supports over 25,000 people in recovery who are living in over 2,500 different certified residences. This little graphic you'll see, currently they have 30 state affiliates that have been accredited, and they have 9 emerging states. So our mission is to support persons in recovery through an alliance of certified recovery residences, upholding a high standard of ethics, promoting best practices, and providing education and advocacy. So you'll see some of the main things we do. Obviously, the certification, there's 4 levels, and then utilizing best practices as well. So quickly, this is just a little history of recovery residences. Way back when we thought the best thing to do with people that were struggling with substance use disorder was just to separate them and move them away from everyone else. We had obviously the asylums or the inebriate homes, and then we had drying out farms. In the 50s and 60s, you started to see some 12-step houses that were really an outgrowth of Alcoholics Anonymous and the popularity there. In the 70s, we started hearing the phrase sober living houses. And in the late 70s, the social model emerges. And in the 80s, that's when we start to look at, I guess, a certification process, or really just starting to acknowledge the fact that there were a lot of these types of residences opening up. And Georgia, which is GAR, they were actually the first people to the first state to come together and try and develop some standards in a certification process. GAR would eventually start working with the Association of Halfway House and Alcoholism Programs, which was kind of a loose collaboration of residences that were sort of operating in this space. And in 2011, NAR was established as a national organization. 2021 is when R gets established. So this slide just tells you a little bit more about NAR. If you're interested in this, please go to their website, naronline.org. They have a lot of great information there about sort of the history of recovery residences and how we got to where we are today. So this slide looks a little chaotic, and that's on purpose. So one of the simple reasons R exists and NAR exists is to try and unite some language, or try and come up with a nomenclature that really accurately describes the services that are offered in a recovery residence. So obviously a lot of people have heard of Halfway House. That's kind of the one that we hear the most. And it's also the one we need to stop saying. We don't need to refer to recovery residences as halfway houses anymore. It's almost got a negative connotation and kind of makes you think that the people there aren't whole people, or sober house, sober living, therapeutic community, recovery house, three-quarter house. We sort of land on recovery residence because that's the most accurate description of what should be happening. When we think about a residence, it's almost more than a home. And when we think about a recovery residence, what should be happening in these places is recovery. So it's just very clear and easy and a good way to kind of talk about this. So it's a broad term describing a sober, safe, and healthy living environment that promotes recovery from alcohol and other drug use and associated problems. Thousands of them exist in the United States, thousands upon thousands. They vary in size, organization, and target population. The exact number is unknown. And again, that's one reason why NAR exists and why the state affiliates are trying to really begin kind of reeling things in, because many of you might know of a place that sort of opens up and they call themselves a halfway house, or they call themselves sober living, or they call themselves a recovery residence, but there's really nothing, or there's not anyone to tell them what sort of services they should be providing. And in a lot of ways, it's kind of like the wild, wild west. Anybody can open up, anybody can rent a house or build a house or and call it sober living, when that might not actually be what it is. And they might be more concerned with just putting bodies in bunk beds and getting them to go to work and taking their rent checks. And there's not much recovery happening there. So at minimum, they should offer peer-to-peer recovery support. Some provide professionally delivered clinical services, and that's speaking nationally. We'll talk a little bit more about what it looks like in the state of Alabama. If there's any clinical services being delivered on site in a recovery residence in the state of Alabama, then it's going to be certified by the Alabama Department of Mental Health, probably as a 3.01. If anyone's familiar with the levels of care, that's kind of what we're talking about there. Benefits of a recovery residence: obviously reinforces a substance-free lifestyle, provides direct connection to other peers in recovery, connection with mutual support groups, builds recovery capital, and utilization of the social model of recovery. Easiest way to think about the social model, if you haven't heard of that, think about a greenhouse where the focus isn't necessarily on the individual flower or plant inside the greenhouse. The focus is on the residence itself. The focus is on the greenhouse and the environment that you're trying to create to allow the plants to grow. Primary purpose: provide a safe and healthy living environment, obviously abstinence, and to foster improvement in all of the things: the physical, the mental, the spiritual, and the social well-being. So where does it fit into the continuum of care? I think this is a useful graphic. We can think about medical detox. We can think about residential or inpatient with clinical services. And then there are these other three, PHP, IOP, and aftercare. All three of those can be operating in conjunction with individuals at a recovery residence. So I tell my story a lot. I'm a person in long-term recovery. I went to treatment 2 times. Not too much changed in the actual treatment model. There was a little something different going on with me. And the first time they suggested a recovery residence when I left, and I didn't take that suggestion. The second time I was a little more willing and I took that suggestion. And what I say is treatment is wonderful and it was needed and necessary for me, but a recovery residence is kind of what I think saved my life and got me to really start understanding what it meant to think about long-term recovery and that. So standards, why do standards matter? I mentioned the nomenclature. It just allows for a more meaningful and productive conversation. It translates across the states. Like I said, now recognized by SAMHSA, there's an inclusive framework, 4 types of support. We'll get to that. And it unites this fragmented knowledge base that's out there. A lot of people have different ideas, and when they think about a recovery residence or when they think about sober living, all they know is what they know. And maybe it's this place they went to and they think that's how you have to operate, or it's this place they've heard about and they think that's how you have to operate. But what NAR and R is able to do is really make sure people have all the information and are educated on the best practices and the best ways to do this. So again, this slide is really just kind of leading or lending credence or credibility to what R is doing and what NAR is doing. These are the 4 major dimensions of recovery as defined by SAMHSA, and a good recovery residence is going to address all 4 of these: health, home, purpose, and community. There's a couple links down at the bottom. I'll pop them into the chat. But last year, SAMHSA actually released their best practices for recovery housing. So now there's a SAMHSA document out there that clearly defines what we're trying to do. These are the 4 levels very quickly. Level 1, I mentioned the Oxford House. So if you're familiar with an Oxford House, that's essentially level 1 when it comes to NAR and R. So it's peer run, democratically run. There is drug screening. There are house meetings. Self-help meetings can be encouraged. Generally, these are single-family residences, but there are no paid positions. There might be a senior residence or a house manager, but essentially it's peer-based and peer-ran. Level 2 is monitored. So at level 2, there's the house manager and the senior resident, and there's a clear sort of definition of what they're trying to do. There's rules that provide structure. There can be peer-run groups on site in the house, obviously drug screening, and there's at least 1 compensated position for level 2. When we get to level 3, that's supervised, and this is where you start to see a lot more structure. There's an organizational hierarchy. There's administrative oversight. So there might be a program director, and there might be a program manager, and then there might be resident managers, and there's going to be sort of a clear supervisory structure when it comes to staff. There's going to be some life skills development, usually in level 3. Clinical services can be utilized in the outside community, so not delivered on site, but we have a number of level 3 certified providers right now where what they do is they have it structured so that the residents are showing up after residential treatment and following all of the treatment recommendations, which include IOP or an outpatient program, and the residents is making sure that those residents go and show up to the outpatient program, receive that level of treatment during the day, come back to the residents in the afternoon, but those sites are always delivered off, or I mean, those services are always delivered off site. And it's collaboration or partnership. So these can vary when it comes to the type of residence. A very popular model right now is an apartment model where there's a larger apartment complex and a residence might be 4 or 5 apartments within that complex. Or it can also be standalone houses. The main difference, or one of the main differences between level 2 and level 3, level 3 is going to have someone on site 24/7. So they don't necessarily have to be working 24/7, but I'll use one certified provider or certified residence as an example. They have a staff house on site and staff live in that house and they're on call. So the last room check might be at 10 p.m. And then if anything happens between the hours of 10 p.m. or midnight and 8 a.m. when they do, when they hand out medication or they don't hand out medication, when they allow residents to come over and get their medication, the person is just there available on site. Level 2, that's probably not happening. It could be someone who shows up during the day and they might do some drug screening, they might do some group work, just peer group work with the residents, but then they might go home and the residents might be left to themselves overnight. So that's a big difference between 2 and 3. Level 4, I mentioned. Level 4 really doesn't exist. It's not going to exist in the state of Alabama. At least that's kind of how we see it, because if you do have any clinicians on site delivering clinical services, then you will need to be certified by the Alabama Department of Mental Health. And that will look a little different than the AARR certification, or a lot different. But there's a lot of other states out there where it's set up that their NAR affiliate is actually certifying some clinical services. Okay, so quickly, here are the standards. So under each standard, there's a lot of criteria, a lot of things that have to be met, but NAR has broken it up into 4 domains. So we'll just go over these very quickly. Domain 1 is administrative operations. That operate with integrity is very, very, very important. If you're going to be AARR certified, you have to have a code of ethics. You have to operate under a certain code of ethics. Domain 2 is physical environment. So again, I'll mention some things. We all know of places where we would not want to send our loved one. These are residences that open up, and I'm sure we've all heard horror stories about the types of spaces that people are being asked to live in. So NAR puts a premium on physical environment, making sure it's a home-like environment, making sure it's safe, making sure it's healthy. When we do our certification, we include a site visit. There's a couple things that happen after you file the application. One is a documentation review that can be quite lengthy because there is a lot of stuff included in your personnel policies and procedures that we have to see and we ask for. After the documentation review, then we do a site visit, and that's where we look at domain 2 primarily. Domain 3 is recovery support. Again, the idea of a social model of recovery is very, very important to AARR and to NAR. There can't be, in our opinion, a recovery residence that isn't utilizing peer recovery and isn't connecting the residents to the greater recovery community to make sure they are in the best position when they leave. That's recovery capital 101, really. Domain 4, simply put, be a good neighbor. We think about things like that So there are some standards that have to be met around that as well. So this slide just shows you some of the things that we do. We do offer a lot of trainings throughout the year. We have a best practices training that is based on the SAMHSA document. We have a training for anyone who's sort of interested or just thinking about opening a recovery residence. And that's called launching and leading a recovery residence. And then we have our prepare to be our certified training, where we actually walk people through the certification process and try and make sure they're not caught by surprise. My sort of pitch there is when I went through the sober living here, and it was actually in Bessemer, Alabama, they decided to open up a recovery residence down in Pensacola, Florida. And I moved down to help them open that up. And we were notified at that time that in order for us to receive referrals from some of the treatment facilities down there and through the courts, and Florida had legislation on the books that sort of said referrals can only be made to FAR certified residences. And so FAR is the Florida Alliance of Recovery Residences. We had to become FAR certified. I went through that process, and FAR was so helpful and so easy to work with. We had a lot of good policies and procedures in place. We were doing a lot of the things the right way. We just hadn't documented it, and they helped us get really, really organized and did the site visit. I was scared and overwhelmed and all of that. And the people at FAR walked us through it. And so that's what we're trying to do here. If anybody is overwhelmed, we're here to help. And we want to make sure you know that. There is a consultation service. Robbie Keeble's another one of our board members. There's his information, and there's my information. If you would like to talk about what it would look like to get certified. All right, I think that is it. There's the website with more information, and I will stop and answer any questions.
Thank you, John. Does anyone have a question for John at this time?
Yeah, I do. So what is the expected time you think it would take to get certified? Just ballpark.
So that really kind of depends on where the residence is at already. Like if they've been operational for a little while, and like I mentioned, they've got good policy and procedures on the books already, and we're able to just sort of lay eyes on that, crosswalk some things with the domains and the standards. It can be as quick as a couple months. It has taken other residences a little longer because they're kind of starting from scratch.
Thank you, Kathleen and John. At this time, we will move on to Ms. Susie Knight with SpectraCare.
Hi, thank you for the opportunity to share about the services we provide here at SpectraCare, particularly around our substance use services. SpectraCare is a comprehensive community mental health center. We're located in the southeastern corner of the state, and we cover a 5-county area that consists of Barber, Dale, Geneva, Henry, and Houston counties. However, we do operate 2 substance use residential facilities, level 3.5, and those programs provide services statewide for individuals. So I tell you just a little bit about our system and focus really on that substance use level of care. But a comprehensive center is one that provides substance use, developmental disability, and mental health services. And so that's what we are in our part of the state. To access our services, it's really easy to do. We have a 1-800 number that our Access to Care Director, Brian Thomas, who's on the call, and his contact information is listed in the chat. Brian shared with you all of the ways to get in contact with SpectraCare, but Brian coordinates access to our system for all of those divisions. And so we have a full-time staff. Brian is the director, and 4 other bachelor's level access to care specialists whose job all day long is to make sure individuals within our catchment area are connected with services. One of the first things that they'll do, of course, is arrange for an intake. We will do the screening over the phone for substance use issues, mental health issues, and determine what the level of crisis is. And then Brian's department will connect with our outpatient divisions in any of our counties to schedule or arrange for same-day access for an intake. We do offer same-day access in all 5 of those counties, and if there's a crisis and we have someone call that 1-800 number from another area and they need assistance, telehealth could be arranged for an intake for other areas as well. At SpectraCare, we do use the ASAM placement assessment. We're a little different from other providers in that the ASAM for us is both the intake tool for mental health and substance use services. And so if you call and you walk into any of our clinics, your intake won't just be for substance use. You'll also complete with that same tool, that same appointment, your mental health intake. And so we'll determine what issue is primary if there's a co-occurring issue, and we'll be able to either route for mental health or substance use, or if co-occurring services are appropriate, then we would schedule for that. That intake appointment, Brianna Grayson is our outpatient director, and she is on the call as well. She can be accessed through that 1-800 number. If anybody has questions about those intakes, she or Brian, either one, can answer those. What we found when we went to that one intake for both mental health and substance use, that really just made, for us, it's no wrong door. You can access your services at any one of our clinics, both for mental health and substance use. And we know that delayed care means less favorable outcomes. And so we want to make sure that intake is offered on the day they call, or if they prefer to schedule, we'll do that as well. Within our system, we do offer different levels of care: outpatient, intensive outpatient, and we have 2 residential facilities. And then medication-assisted therapies are available within all of our levels of care. Our outpatient substance use services are available in all the counties we mentioned, and our intensive outpatient is available in Houston County. Brianna is the director of those programs and can provide and answer any questions. A lot of times the questions about our levels of care for outpatient and the intake is just about cost for our the individuals we serve. There's no cost for the intake, and they're informed. Anybody who calls is informed that at our access to care department. For outpatient and intensive outpatient services, fees are based on a sliding fee scale that they're made aware of at the intake if they do decide to opt for services with us. And if they're unable to pay, then that's certainly addressed with that intake at that appointment as well. We want to make sure that cost is not a barrier. We want to work with everybody, and so that sliding fee scale with the 0 fee schedule there is available to anyone who comes to see us. Most individuals we all know and who are referred to us, when we think of substance use care, everybody thinks that it's going to be a residential program. We believe that recovery can happen and the journey can start in outpatient or intensive outpatient, and we certainly encourage that least restrictive level of care. And so we will try outpatient and intensive outpatient, and if needed, then would increase the level of care, but always want to go with least restrictive. We find that there's a challenge within our court systems to always go straight to that residential placement, but if possible, we want to place an outpatient. I'll talk a little bit about the Haven and our co-occurring programs, because those are 3.5 levels of care. The Haven is a 32-bed residential treatment facility in Dothan, The Haven's been in existence over 55 years now. We have 16 beds for adult males and 16 beds for adult females. Admissions are available statewide, and those admissions are based on the priority populations that established by SAMHSA, the Department of Mental Health. And so if you're not familiar with those, we'd be glad to walk you through them, but I think most everyone is. Of course, a pregnant female on any waiting list would get first priority with us. We do operate at the Haven off of a waiting list that's statewide, and so once that individual is placed on the waiting list, we work that in order. Generally, the waiting list for us runs probably about 2 months, but obviously individuals who are on the list have to be ready, willing, and able to present for the bed. And so if they're not able to come on that day that's scheduled, we work that list every single day to make sure that our beds are full and that we're using those to serve the individuals, not just in our community, but statewide. It's fairly simple to get a bed at the Haven. You've got to have that placement assessment completed. You've got to meet the substance use disorder criteria, and that intake can be sent to us. Brian has included all of our contact information for providers who are interested in placing individuals on our waiting list. Ways to get those intakes to us. We will need that ASAM placement assessment. The process is the assessment is sent to us. It's reviewed. We get back with that referral source with any questions. A lot of times that's about medications, or it could be about transportation to the program. Any questions that the referral source or that individual or family member has, we'll contact and let them know, what's expected and what they can bring, what not to bring, etc. while they're there. 32 beds a day in the life of the Haven. I'll talk a little bit about that. And our clients are up at 6 o'clock every morning, and then there's a structured program that includes individual, group, family therapy throughout the day, 7 days a week. And then support group meetings at night could include Celebrate Recovery, 12 Steps, many other support groups come in and are offered throughout their stay with us. We have the second program that I'll talk to you a little bit about is our co-occurring program. It is a 16-bed residential facility, again 3.5, and that's located in Midland City, Alabama. 8 male beds, 8 female beds there. And the co-occurring program is a co-occurring enhanced. And so individuals who are admitted to that program have both a substance use disorder and a serious mental illness. And so we need those two. Same process for referral. They can be shared. We need the ASAM placement assessment as well as that mental health assessment. And then the intake is reviewed, questions are answered. We follow up with that referral source. Any questions, then we come back to place them on the waiting list and contact the individual, that referral source, family members, whoever it is that's identified that can assist with getting the person there. We do work with many jails, court referral officers, probation, for individuals who are in jail and but who want treatment, who the judges have ordered that participation in treatment is part of their sentence. Then we do admit directly from jail. Sometimes our individuals will go straight back to jail if that's part of the court order, and then other times they're released back to their community with a solid aftercare plan. Admission to the Haven, we do have a $350 admission fee. Of course, most of the individuals who are admitted don't have that. Probably 90% of those that we see, we never see any of that payment. But we do ask that individuals who are able either bring some of that admission fee with them, or that once they are established in recovery, that they begin paying toward that. We believe that financial responsibility and paying it back is part of their recovery program. But again, as with our outpatient, intensive outpatient, ability to pay is no barrier for services to seek help with substance use here at SpectraCare. I think providers of choice is important. If individuals come to us at our outpatient program and they are recommended for any level of care, we're going to offer them lists of certified providers, not just in our area, but throughout the state, if that's what they're interested in. So if it's a residential placement that's been recommended, they would be offered for those intakes, and that referral to be made statewide, not just to our programs. And that's the same with our outpatient programs. They've provided a list of certified providers. I think that's important that they're made aware of what their choices are. And just because they've had an intake with us doesn't always mean that they have to receive their treatment with us. We only refer to certified providers within the state, and of course the ADMH provider directory is the main source that we'll use to locate those referral sources. Typical stay at the Haven is anywhere from 14 to 28 days. Treatment's individualized, so it's based on what is appropriate for those people that we serve, and then we look at always a solid aftercare plan. It could be back to an outpatient program or support groups or recovery houses. And we have staff in place. Our case managers, therapists work real hard to make sure that they are linked with resources back in their community, wherever they came from throughout the state, so that aftercare plan is solid. We know that the longer an individual stays engaged with any type of treatment or in recovering housing, the greater their chances are to maintain that recovery. So we do all we can to encourage that post-treatment with us. That is a really quick discussion. I'm not sure who all my audience is today, if I'm talking to certified providers or if I'm talking to those who are just interested in services. So I'll be happy to answer any questions that you have, either on this call, or feel free to reach out to us with that contact information that Bryant's provided.
Thank you, Miss Susie Kingry with SpectraCare. Does anyone have any questions for Susie? You're able to unmute and ask, or you can put those in the chat and I will ask for you. All right, and as she stated, their contact information is in the chat. So if you think of something later on, definitely reach out to them. Thank you again for your time and sharing your services with us. All right, at this time, we will move on to Miss Christine Smith, and she's here today with us from Ross.
Look at Judd smiling hard, knowing he roped me into this. Don't smile that hard, Judd. All right, good afternoon. My name is Christine Smith. I am the agency administrator of Ross. And I'm not going to teach the way I normally teach, because I will inform you all the way I normally do, because I like to ask questions to see what the agency's needs are, so I can figure out how we can fill in those gaps. So I'm gonna leave that part out, and I'm gonna just tell you who we are, what we do, and hopefully answer some questions along the way. Okay. So there we go. All right. So Ross, we are an agency that we've been around since 2017. We have 6 recovery community centers. They're in Birmingham, Montgomery, Albertville, Gadsden, Huntsville, and Tuscaloosa. At each of these recovery community centers, individuals can come in and be linked up with a peer navigator, and that individual would basically help them navigate their process or their steps in their recovery, whether that means giving them one-on-one support, letting them get linked up with meetings in the area, or just whatever that individual's needs are in that moment. And they work with them throughout that process. We also have our 24/7 helpline. That helpline can be reached at any time, any day of the week, including holidays. We don't close for Christmas or New Year's, okay? So with that being said, that they can receive referrals, information, companionship, just whatever is needed, they can receive that from that 24/7 helpline. Every individual that answers that phone is in recovery. And I think the beautiful part about that 24/7 helpline is that is your access. That's your doorway into anything that you may need from Ross or dealing with Ross. We have outreach. This is our Boots on the Ground program. They do from marketing events to working with different treatment centers and coming in and providing individual peer support groups to different agencies. We have those in 38 counties throughout the state of Alabama. We also have peers in some of our MAT clinics. They provide also peer support on a one-on-one and a group basis. We have our RCSP program, and I'm going to transition to that piece in just a second. And then I also have a piece for our Safe Care Special Women's Program. We have our Road to Recovery program. This program is set up to help individuals get from jail to treatment. They have to fall inside of a certain criteria in order to do so. Like they have to be court ordered and so on and so forth. But if there's anyone that is interested in getting an individual into that, again, their access to that to get that referral is through the 24/7 helpline. They would just call over. That's also, we have our hospitals program where we have peers in our hospitals working with individuals who just faced or suffered from an overdose, and they're trying to catch them right there in that space of reality before they transition back out into their active opioid use disorder. We have a partnership with Medicaid and also with Project Freedom. So let's bounce back. We have our RCSP program. For a lot of us that decide to pursue higher education, you know the steps for that. You go to school, and during that schooling, after you've been in school for a certain amount of time, you have to in turn go and do your internship. You do your internship, get your internship hours, and you graduate, and you got to pay these people back the money. So I want you to think about the RCSP program kind of in the same aspect, in the same way, but it's really for peers. This RCSP program basically take what we like to call babies in their recovery, and it helps them. It trains and shapes them into better professionals. So when they get ready to go out into the workforce, their peer services are amazing, like their support group skills. Because as a lot of you know, like that have peers at your agency, a lot of the peers only know how to facilitate support groups like 12-step meetings. So this program actually helps them grow up, helps them change the type of peer services that is being provided. Again, it's our internship program. We take these individuals, to enroll in this program. Sorry, let me start over. They have to have 3 to 6 months in recovery. It doesn't matter if they don't have their high school diploma, don't matter if they don't have their driver's license, doesn't matter if they have their GED, like doesn't matter. This program is designed to help them get that, right? The beautiful part about this program is that once they get a certain amount of time in recovery, it's a paid internship. And so what we've done, we've partnered with different agencies throughout the state that allow us to send the interns to their facilities to work, and then we pay them under the RCSP grant that we have. So I'm gonna say it again because a lot of people miss it. We send y'all to work and we pay them. That's basically what it is. So if there's an agency that's interested in partnering with the RCSP program, please send me a message, or you can reach out to the actual RCSP program. Their email here is listed below. And this program walks them through getting state certified as a peer, and then after they're state certified, they can stay in the program for up to 3 months, and they actually help them find employment as a peer. The data on this program is absolutely amazing. As far as like test scores and job placement, like individuals do well. Doesn't matter what type of program it is. Again, if you're interested in sending individuals, because we all work at agencies where they say, hey, I want to do this. I want to be a peer. I want to give back. This is an excellent program to get them linked up with and get them sent in for services. Doesn't matter where they are in their recovery, as long as they got 3 months or more. And it doesn't matter if they have all of the prereqs that are required by the state office in order to get that certification, okay? RCSP. So the other program we have is one of our newer programs. This is our Safe Care program. With this Safe Care program, Safe Care, their primary goal is to assist in infants that have been exposed to substances by their caregivers. And so with this program walks with the mother, with the pregnant and expectant mother, through navigating the system as far as DHR, the courts, and they help those kids stay at home. And I think a lot while those kids are staying at home, they work with the mother to educate the mother. They work on educating the family as a whole, really by providing different parenting skills, life skills, while also getting those services for her substance use disorder. This program, they trying to make. I want to see if I see it. Just a second. No, it's not on this one. It's on the flyer. I won't pull that flyer up. So in order for an individual, let's say you have a mother that has tested positive and you feel like that individual would benefit from a little bit more. Again, through the helpline 844-307-1760, that individual, just make that call, let them know that they're interested. It is, again, services for both the mother and for the expectant, for the expectant mother and for the infant. This is one of our newer programs that we have. Trying to make sure I don't go all the way over my time. So I'm trying to bear with me. I'm trying to make sure I tell you about everything we have. But that's Ross in a nutshell. Again, we ain't been around long. We've been around since 2017. If you're an agency and let's say you're an agency, you don't necessarily have a peer on staff and you are interested in getting peer services for the individuals that you serve, reach out to us. We have, especially if we have a community center in your county, we can block off times at our community centers where those individuals at your agency can get a peer support group. All of the peer navigators are trained and equipped with that ability to provide a peer support group that does not mimic any 12-step pathway. And so when we're talking about those peer support groups, that's on things like that self-care, compassion fatigue, like staying engaged with my recovery, navigating, the systems, like just different things like that. So that's one of the bonuses for our any agency that's in a county with our recovery community centers. If you're an agency that's not and you want to get individuals that service still, we do provide all of our peer support groups at our community centers via Zoom. Just send us a message, call the helpline, and we will get that Zoom link information sent over to you. Trying to make sure I tackle everything on here. With our outreach program, because this is the misconception with a lot of different agencies, our outreach program, if you have a client that is linked up with our outreach worker, we do provide transportation for individuals that are enrolled in with our outreach program. If we have individuals that come in the community center and they're linked up with a peer navigator, they also receive transportation to and from services as well. Double checking my cheat sheet here. Yep, I think that's it. That's us in a nutshell. So if you're interested, referral, helpline, 844-307-1760. I'll put my email in the chat. I'm gonna put my cell phone too because I'm never at my desk. Call me. Just call me. Ain't that right, Julie? Call me. I'll email you back, but it might be a couple days because I ain't never at my desk. All right. We appreciate y'all having us. We love everybody. Roll Tide. I mean, I don't know what y'all want me to do. Look at David. David knows.
Hey, Christine, can you talk a little bit about some of the activities and services available at your centers?
Absolutely. So they vary from center to center. I don't want to be dishonest, right? So some of our so at all of our centers, we have a veteran support group where those individuals link up with other veterans and they talk about veteran stuff. That's all I'm gonna say, okay? It's the same way with our centers. All of our centers have a men's support group. They link up with other men and they talk about men stuff. Now, I will say this. Some of the groups, the peer groups, are targeted towards recovery, but then some of them are targeted towards the whole person because holistic care, right? So they may not necessarily be recovery focus on recovery. It may be the person. We are getting ready to launch our 30-minute meals session where y'all know how it is for us. I'm sorry, let me start off. My name is Christine Smith. I'm a person in long-term recovery. So a lot of us, when we are coming out, we don't know those basic living skills like preparing small meals, caring for home and stuff like that. So we have a life skills group at all of our centers that does just that, because I know sometimes working at agencies, that whether it's the case manager, the therapist, like we struggle squeezing those things in, especially when we're talking about like building a treatment plan, right? So our centers are focused on those areas of gray that are needed at these different from these different agencies, right? Let's see, we have LGBTQIA plus support group. We have a lot of them. They just vary depending on the center. But if you visit our website, rossforyou.org, find the campus that's closest to you. Those schedules are posted on our website as well. Okay. Thank you, Judd. Good question. I appreciate that. Look at him trying to make me not be mad at him. We still beefing, Judd. We still beefing. Anyone else? Any other questions I can answer? All right. Hey, David, how are you? Thank you so much again, Miss Tony, for having us on. We really appreciate the invite. We really do.
Yes, thank you, Christine. We appreciate it. And thank you, Judd, for the question. One last call for questions for Miss Christine Smith from Ross. All right. Any questions for either of the other two presenters that we had before we end our call today? All right, again, thank you all for joining us today. And thank you to the participants for joining us. We hope that you were able to learn something new about a resource available to you in Alabama for treatment and recovery. Again, please join us on May the 1st for our next virtual meeting, and I hope everyone has a wonderful day. Thank you.